Hi everyone, this is Dr. Larry Conway. I'm Director of Cardiology at the Melrose Wakefield Cardiovascular Center. I'm here to talk to you today or tonight, whenever you're watching, about family history of heart disease. What does that mean? You know, it's so important. There's a genetic component to so many diseases, and certainly for heart disease, and we're just beginning to understand what that is. But what we do know is that when we see you in the office, we're going to ask you about history of heart disease in your family. And people often ask, well, what does that mean? My grandfather had a heart attack at 80, does that make a difference? And it does, but there's something that's more important. So the definition of family history of heart disease is that a male direct relation, so your brother or your dad, had heart disease, mostly a heart attack, at age less than 55. Women tend to get heart disease later than men, so if your sister or your mom had a heart attack or stroke at age less than 65, that tells us that you have a family history of heart disease. And it's important because, you know, genes determine what happens, and we want to know about that to help best take care of you. What's important, though, is that you can't really change your genetics, but you can certainly change your lifestyle. And so if you have a family history of heart disease that we're concerned about, what do? We're going to tell you to lead an active, healthy lifestyle. And that's eating a good, healthy diet, going for a walk every day. Because if you do that, even if you do have a family history of heart disease, you cut that risk by 50%.